1 in 4 people in the UK live with long-term conditions such as diabetes, arthritis, depression or chronic obstructive pulmonary disease. And of these people, 30% will have more than one long-term condition, which is more likely if you're older or from a deprived background. And 50% of all GP appointments, 70% of all bed days in hospital, and 70% of the total NHS and social care spend in England is on people with long-term conditions. Care often focuses on treating the disease, not the person, and one condition or symptom often gets treated at a time with little or no consideration for how all these link together for the person, and problems with mood and memory may be missed altogether. People with long-term conditions will often only spend a couple of hours a year with their healthcare professional, and yet they live with and manage their conditions on a daily basis, developing a wealth of experience and knowledge about their own conditions and what works for them. Here is where we need to shift the thinking. People are more than just their conditions. We need to move to a person-centred approach which not only looks at all the aspects of a person's health and well-being together, but also gives that person the power and knowledge to make decisions about their health collaboratively with their carers and their health and care professionals, all working together through collaborative care and support planning. People with long-term conditions have described the type of relationship they would like with their healthcare professional as being two adults in a room, both listening, respecting each other, valuing the perspective, expertise and knowledge of the other, and making decisions together. As well as being the right way to support people, we know that this approach works. People are much more likely to follow through on decisions that they have been involved in making, and clinicians report that it's a far more satisfying way of working. We need to move from asking, what is the matter with you, to what matters to you. NHS England has developed a short document, Our Declaration, which sets out why action for person-centred care is so important. We know this kind of change won't happen overnight. It requires leadership and dedication from both people with long-term conditions and the professionals who care for them, working together. Our declaration calls for co-production, which is when people with long-term conditions work together with health and care workers, commissioners, managers and policymakers to design the services and support that they need. While our declaration goes some way to explaining what good care looks like, we do recognise